anterior hip procedure has been a procedure which has been around for a long period of time, but very few people utilized it until they were able to develop instruments that you could get adequate access to the parts of the body that you need to put in your prosthesis. That's been much more helpful in the short term in that it is a muscle sparing procedure and it has less pain because you're not going through muscles, but you're just kind of pushing the muscles to the side. They're quicker to rehabilitate, less chance of blood clots most likely, and more mobility. And I think long term it probably adds benefit also in that it has a much lower risk of hip dislocation.
I'm Marcia Murdock from Lander, Wyoming. I work for the state of Wyoming reclaiming abandoned mines and also working on mine fires. I'm out in the boonies a lot on both recreational things and when I'm at work. So I'm in rough country quite often and need to be able to walk properly.
I had talked to Marcia in regards to her hip arthritis and doing a hip replacement procedure in both the right and the left hip.
I was having a lot of trouble with both pain and lack of mobility. I had gotten to the point where elk hunting was very, very difficult last year. It was affecting my ability to go out and do anything fun. And I came in to talk to Dr. Robertson. He put his diagnostic techniques to work and he asked the right questions, and we discovered that I needed 2 hip replacements.
She was someone who had the procedure and has had both the right and the left procedures done 3 months apart from each other, and in both cases left the hospital the next day.
I have been able to recover much faster than I expected. I went from using a walker the day of surgery to crutches to a cane within 10 days. Within 6 weeks, I was able to take a hike up Sinks Canyon, on a canyon trail, over boulders and everything else. A 3-mile hike, and it didn't bother the hip at all. Things I haven't been able to do for several years I can do now without thinking about it.
And one of the other big benefits is that there's no hip precautions after the procedure, which when you do hip replacements in the manner that we have practiced in the past, you always had to kind of be careful of positions that you might get into which could potentially dislocate the hip. And now with the anterior hip, that is no longer the case. We don't have hip precautions. Other patients have seen people who have had hip replacements done through a posterior approach and have seen that it is a much longer recovery. In the short term, their pain is much greater. They walk with a limp. They're typically using walkers or crutches until they get to a point where they can get to a cane, whereas with the anterior hip replacement, people get to a cane or without an assistive device much quicker.
Absolutely come to Converse County Hospital because they'll treat you very well. And certainly I would recommend Dr. Robertson as a very good surgeon who is involved with his patients and concerned about their welfare.
You know, the anterior hip is certainly going to be the procedure that orthopedists are doing for arthritis of the hip in the future. Less pain, quicker recovery, no hip precautions. They can go on living. This is one of those game-changing procedures